I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. You wouldn't wait to refill your gas tank until you're stranded on the side of the road. You wouldn't skip a smoke detector battery change and hope for the best. And you wouldn't put off brushing your teeth until you get a cavity. Those examples demonstrate the importance of planning and preparedness in helping ensure your safety and well-being. Now, the same is true of your health. However, studies show that many people don't stay on top of completing routine wellness and health screenings. These tests and appointments offer an efficient and effective way to catch health problems early before they can become serious. In this episode of Health Inspired Talk, we're speaking with experts about the importance of screenings and preventative care. In our first segment today, we're talking with Dr. Maria Rossi, a family medicine doctor with ThedaCare Physicians Menasha. Dr. Rossi, thank you so much for being with us.
Oh, no problem. Thank you for having me.
So we really want to dive into preventative care for our patients. And what we'd like to do today is we've created some puzzles using emojis, and we're wondering if you can guess what the preventative care measures are and then talk us through those.
Sounds like a plan.
Okay, let's start with our very first one. Up here, you can see the emojis. Any guesses as to what type of preventative care this might be?
Well, with a stethoscope, a calendar, and a check mark, probably a yearly wellness check.
That's it. Okay, why are wellness visits so important?
Well, they help us do a lot of things as primary care physicians. It gives us that one time a year to check in with the patient to make sure they're doing well overall. And it's going to be a thorough exam that goes over their entire medical history, reviews screening tests they need, blood work they need, update medication lists, as well as any concerns they may have.
All right, let's take a look at our next puzzle here. What do you think those emojis represent?
Well, I think with the drop of blood, the microscope, perhaps your blood work that you should be getting done. And I do think this is very important. It is a way for us to monitor whether or not we're doing, as physicians, an appropriate job of managing patients' medical conditions and making sure their medications are appropriately dosed.
Okay, that's good to know. Let's take a look at our next puzzle up here. More blood on this one. What does this represent?
Well, we have a heart, and again, more blood work, as you said, and then maybe some annual cholesterol, blood pressure, and heart screening.
I think that's it.
Yep, and those are all things we do look at at an annual visit as well. A lot of times, patients may already be on medications to treat one of these processes, but if they have a strong family history, it's also important to check those out too.
Okay. All right, next one here. Oh, I like these emojis. This baby here. What does this one represent?
Well, you have a measuring stick with the baby, stethoscope, probably the well child visit and making sure their growth is appropriate. So I would say that is one of the first things we do in every well child visit is make sure patients are tracking appropriately along the growth curve. You never want to see a patient jump too high in terms of gaining or growing too quickly or too slowly over the course of a year. So it's always important to check or over the course of a month, whatever their visit is due.
Okay, great. Our next one up here, any guesses on this one?
The emoji with the Z's would probably make me think about sleep.
Yeah.
So probably sleep and sleep apnea.
Yes.
All very important topics to discuss as well. Sleep is a cornerstone of our overall health. We talk a lot about it in terms of making sure we decrease our risk for heart disease and obesity and as well as just fatigue. So it's important to talk about it at wellness visits.
Absolutely. All right, our next puzzle. I think I know this one. Okay, what's your guess?
All right, there looks like there's a virus and then also a shot, which is vaccines and disease prevention. And again, another one of the cornerstones, as we say, for the wellness visit, but extremely important. Vaccines have been shown by many studies to prevent the spread of illness, as well as the contraction of illness, and prevent death as well.
And then whenever you go in for your annual wellness, will the care teams talk with you about which vaccines are due and what your schedule looks like and all of that?
Absolutely. So it changes tremendously from the age of the patient. So although, especially our patients under the age of 12 months, they have quite a few specific vaccines vaccines that are due at different wellness visits. And those will be discussed in detail by the provider, as well as once you hit a certain age. Especially our patients that are 50 years and older, they tend to have a lot more vaccines that are indicated.
Oh, okay, good to know. All right, our last one here. What does this puzzle represent?
The pill, I think, gives it away. So maybe medications that patients are on. That is something that is very important. Again, one of the first things we do whenever a patient comes for their wellness visit is we go through all their medications, make sure they're taking them appropriately, make sure the doses are accurate and doing the job they're supposed to do. So it's a very important part of the visit as well.
Absolutely. And all these things, again, just really important to start with your annual wellness visit. And how important is it to have that relationship with your primary care team?
Oh, extremely important. The part of the primary care team is to really coordinate the care from all the specialists that they are seeing other specialists. The other opportunity is just to have, again, the relationship is huge because it allows the patient to open up and really bring to the forefront the things that are really bothering them or concerning to them that they may not feel comfortable mentioning to other people. So that's really where our role is to be the first contact of healthcare for the patient.
And again, really important.
Yeah.
All right. Dr. Rossi, thanks so much for being with us and for playing our game.
Yeah, no problem. Thank you for having me. It was fun.
Dr. Mihailidis, an oncologist with ThedaCare Cancer Care, is joining us today to talk about recommendations for cancer screenings. Thank you so much for being with us.
Thanks for having me.
So what we're going to do is we're going to talk through some of the common cancer screenings that people might need, and we're hoping that you can walk us through the recommendations.
Sure.
Okay, so the first one that we have is colon cancer. What are the recommendations for screenings?
So for the average patient who's at risk, we would recommend starting colon cancer screening at the age of 45. And typically we would start this with a colonoscopy, which is considered the gold standard. And that screening would happen until the age of 75, although it's very important to stress that you should be talking with your primary care doctor as far as when the screening should stop based on your individual risk factors. If colonoscopy is not the right fit, oftentimes there's other testing that can be done, including stool sampling and fecal DNA testing as well.
Okay, and what about cervical cancer?
Cervical cancer screenings should begin at the age of 21 based on the American College of Obstetrics and Gynecology recommendations. Typically, that testing would happen every 3 years until the age of 29. And then from 30 to 65, that testing depends on other risk factors that you might have. So it's really critical to talk with your primary care doctor or your gynecologist about what type of testing would be best for you every 3 to every 5 years.
Okay, how about lung cancer?
The recommendations for this are between the age of 50 to 80 for patients that have specific risk factors, including a 20-pack year history of smoking, for patients who are either smoking now or have stopped within the last 15 years. And that's important because some patients might think, well, I stopped smoking 5 years ago, I don't need to have this testing, but you may still meet the criteria for that testing. So really important to talk with your primary care doctor about your risks.
How about for women and mammograms and breast cancer? What are the recommendations there?
One of the important things to remember for breast cancer screening is you should really talk with your primary care doctor about your individualized risks. Some women should start a little bit earlier than the average woman, but we say the average woman should start at the age of 40 with a baseline mammogram and then continue annually. And for mammogram testing, there's really no end time for that. We would say if you are healthy, even if you're over the age of 75, if you would want to have testing and you're otherwise fit, talk to your primary care doctor about continuing with mammograms.
Yeah. So for all these, they're all kind of specific and unique, and yet I'm hearing that a lot of this is, the first conversation is with your primary care provider.
Absolutely. Really, cancer screenings are individualized, so you have to talk with your physician about what would be the best type of test for you, how frequently should that testing be done for you, and when should that testing stop. And it's not going to be the same for everybody.
Right. These are great points that you're making. We really appreciate it. So to continue our conversation about screenings, we developed a Family Feud inspired game. And what we did was we're taking some of the most common things that we hear when it comes to why people might put off a cancer screening. So we have our game board here. These answers are in no particular order. So we're hoping maybe you can take a guess at some of these and then walk us through the things that people might be experiencing.
Sure.
Okay, so on our game board here, any guesses what might be up there?
Well, I know a common reason that I hear from patients is I'm too busy.
Too busy is on the list. So what do you hear from people and how do you address that with them?
Right. So oftentimes life can seem overwhelming. There's a lot of, competing issues in life. But I always say for cancer screenings, it really doesn't take that long. Oftentimes it's once a year. So just get that scheduled in advance. Just say, every May I'm going to go for my testing and have that done. And, you can always find a way to fit it into your schedule.
Absolutely. Other guesses for what's on our list?
I would think maybe patients are afraid of what the test might show.
You are right. That is up there. And again, these are no particular order, but that is something that we hear, that they're afraid of what the outcomes might be. How do you talk with patients about that?
So I think it's always important to remind patients that knowledge is power, in particular when it's about your own body. So finding out what the results of that test is and how you're going to address it is really important. And knowing that your doctor is going to help guide you through those results and what to do about it next.
Anything else on our list? Thoughts?
Maybe they're not sure when they're supposed to have the testing done.
That is on there. I think that is probably something that a lot of people are wondering about, right? Guidelines are different for each person. So how do you address that with people?
So, again, this is where it's really important to have a great relationship with your primary care doctor, and they can touch base with them and say, hey, am I due for this testing? Am I not due? When is the next time that I would need to have this testing done? And they're going to help to guide that for you on an individualized basis.
Okay, great. So we have 3 of 5. Again, no particular order here. Any thoughts or guesses for the last 2?
I'm thinking patients might not think that they need to have the testing done.
It is on there. Don't think they need it because they don't have symptoms.
So we always tell patients the whole purpose of cancer screening is to detect the cancer before you have symptoms or before it's causing real problems for you. And so it's really important to have the testing done. For instance, mammograms can catch a breast cancer even 2 years before you can feel it. And that can lead to better outcomes, better treatment options, and a longer life for you.
Absolutely. So one more on our list.
Okay.
Do you have a final guess of something people might be, thinking about or hesitation from scheduling their cancer screenings?
Yeah, it could be the test itself. They have some fears related to doing the testing.
Let's see. Okay, that is up there. That is the last one on the list. Anxiety about the test itself. How do you address that with patients?
Right. So, we always say, I always tell my breast cancer patients, when you're going for that mammogram, letting the technologist know, the technician, that, hey, I'm concerned, I'm afraid this might hurt me, or I've never done this before, can you guide me through it? We have wonderful staff here at ThedaCare that are very compassionate and are going to help to make the experience enjoyable and easy for you.
And I think we also hear that too for colonoscopies. People might be, worried about the prep.
Yes, no one enjoys having a colonoscopy and, more importantly, the prep that goes along with it. But there's been some changes to that. So you can talk with your doctor about, do I have to drink the liquid? Are there pills that I should be taking? Let them know your concerns and what the best option is for you, and they're going to help guide you.
Okay, Dr. Mihailidis, thank you so much for being with us and playing our game here. We really appreciate all the information you've provided today.
Thanks for having me.
And thank you for joining us. Remember, prioritizing preventative care is a gift to yourself. Schedule your annual wellness visit and any needed screenings early for the best availability of dates and times and to avoid the end-of-year rush. Thanks for watching. We'll see you next time. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.